a lot of people actually wonder, how do we take medicine, especially when we're fasting? Because I have asthma, right? And yeah, so I have to, sometimes middle of the day when I get very tired or when the weather gets very cold, that's when my asthma triggers. So usually I have to pump my inhaler, and I was like, oh no, if I pump my inhaler, does that mean that I'm still fasting? So actually, I found out a while ago that that's actually permitted because the whole medicine doesn't like go through your lungs and whatnot. So that is one way I figured out on how to take my medication while fasting.
So there's actually more to it. It's not just, I always thought, because it's orally taken, or like, when you mention inhaler as well, it's not, it cannot work. It shouldn't be like that. But okay, I didn't know about that. That's a cool fact. But also, like I've mentioned earlier, people actually have the impression, or people actually think of, if I'm taking some sort of medication or any sort of medication, in fact, that you shouldn't fast or you cannot fast. Kira macam batal puasa, right? But I think there's more to it, because since you mentioned this as well. But I want to know more, and I've never really understood much of the mechanics of taking medicine during fasting. I have fasted before, actually. That's a very good experience for me. I fasted with my sister. That was a very good experience. But at that point, I've never really seen or anybody in my family who was taking medication or was on medication during fasting. So this is something that maybe we and you guys at home as well can further understand, comprehend how you can take your medication while fasting. So I feel like we've mentioned too many medication while fasting. Medication while fasting.
Very, very important, because while you're being sick, you still have to, of course, fast and whatnot. So how can we actually properly do it while ensuring that we stay healthy? We're going to speak to Nur Athirah, a pharmacist from Shah Alam Hospital. Welcome.
Hello. Thank you for having me here.
Thank you. I love your top, by the way.
Thank you very much.
Let's just say your top matches the set.
Yes! Thank you very much.
The colours of it.
Yeah.
So Athirah, I actually just want to ask you, how's your Ramadan so far?
My Ramadan has been good so far. It's been tiring because of work, but other than that, it's been okay. It's been fine. Yeah.
All right. So we're just going to get into it, because again, it's such an interesting topic, right? The first question that we have here is that, can Muslim patients who is undergoing medical treatment fast? Because that's a more important question, because very often when we say we're sick, that's an excuse for us to not fast. So very curious on how can we fast while still be able to do our treatments?
All right. So I think as a Muslim, we've learned early on that fasting is actually one of the 5 pillars of Islam. It's the 3rd pillar of Islam. In fact, for the month of Ramadan, it's actually mandatory for a healthy adult Muslim to fast, as commanded by Allah in the 2nd chapter of the Quran. Nonetheless, there are Muslims who are unable to fast for whatever reasons. And for that, we have what we call a ruqsah, which is a leniency that's given to these Muslims who are unable to perform any of the commandments. If they are unable to fast, they are exempted from fasting. They can break their fast. However, it is their responsibility to make up for that at some other time. So how do they make up for it? It's either by what we call qada puasa, make up for the fast during other following months. Or they can also pay fidya. Fidya is a type of donation that's given to the poor and needy. So it's like what we call secupat makanan for each of the fasting days that we miss, which is equal to about 670 grams of food. So in terms of money or food. That said, can Muslim patients who have chronic diseases fast? Yes, they can. It is possible for them to fast safely. However, it is also encouraged that if they do intend to fast, they talk to their doctors about it and speak up about it, so that, as the healthcare professionals, the doctors, the pharmacists, they can help with managing their conditions and their medications. It is very important for these patients who live with chronic conditions such as diabetes or hypertension to not discontinue their medication just because they're fasting. Because, unfortunately, the disease doesn't take a break during Ramadan, right? So you're still sick, and if you don't take your medication, it can lead to very dangerous situations. So if you're not sure how to take your medication, you can ask the pharmacist at whatever facilities that you follow up in. You can even go to any community pharmacies, and we're just happy to help you manage your medication.
Okay, so you mentioned like people with chronic diseases, they can also fast as well. But can you tell us like what are some of the conditions that would probably exempt patients from actually fasting?
All right, there are a few situations that would exempt a person from fasting. So first of all, if a person is sick, if a person is ill, and they are in severe pain or in severe discomfort, so much so that it necessitates them to break their fast, because if they continue fasting, it will just bring them more harm than good. Or it just slows down their recovery. They are exempted from fasting, or they can break their fast. However, for this situation, they would have to make up for their fasting later on during the following months. They have to qada puasa. Second situation would be a patient who has a terminal disease. So it's not curable, they have a terminal disease, or they're inherently frail. So those patients, they're exempted from fasting. They do not have to make up for their fast. However, they do have to pay the fidyah that I mentioned just now for each of the days that they missed their fast. Another situation would be pregnant ladies and also nursing mothers. So for these situations, there are two concerns that you can consider. So if, for example, a pregnant lady, if she's concerned about her health, or if a nursing mother is concerned about her health, then they can't break their fast or be exempted from fasting, and they have to qada puasa again during the following months. The second concern is if they are concerned about their pregnancy, about their baby, for the pregnant lady, or for the nursing mothers, if they're concerned that their milk supply would drop, because they're fasting, or if they're concerned that their baby is not going to have enough nutrition, they are also exempted from fasting. However, they have to do two things. They have to make up for the fast during the following months, and they also have to pay fidyah for each of the fasting day that is missed.
Right. Well, that's actually very, very interesting. So things that you don't know, especially to those of you pregnant mothers out there, and also those of you who do take medication. So we know that there are very different types of medication. You mentioned people with diabetes. You basically you cannot stop taking your medicine. You still have to take it. Like you said, the disease does not stop. I'm actually very curious which medication that renders the fasting invalid and which one doesn't.
Okay. There has been a lot of discussion already, so this issue has been discussed extensively by many religious experts around the world. There's many differing opinions, but for us, we have JAKIM, and JAKIM actually released a guideline called Fasting Guidelines for Patients in 2013 that lists down what medications that can invalidate the fast and vice versa. So examples of medications that can validate the fast, the most obvious one, of course, is oral medication. So anything that's tablet form or capsule form, anything that's liquid medication that's swallowed, that will, of course, invalidate your fast. The second example would be any medications that is administered via the vagina. So we have the pessary or vaginal tablet that will invalidate your fast as well. Any medication that is inserted into the anus, like your suppositories, your enemas, that will also invalidate the fast, and also general anesthesia that involves gas, so that will invalidate your fast as well.
Okay.
So on the flip side, medications that will not break your fast would be your eye drops, as well as your eardrops.
Right.
Okay, sorry. So eye drops and eardrops. So for eardrops, as long as it doesn't exceed the limit of your eardrums, so it won't validate your fast. Any nasal spray or nasal drops, as long as it's in the nasal cavity and you don't inhale it, it won't validate your fast. Mouthwash, as long as you gargle and spit it out.
Don't drink mouthwash.
Don't drink mouthwash.
Ladies and gentlemen.
Yes. So any topical medications, cream, ointments, patches, it will not validate your fast. Any injectables that is administered through the blood vessels, skin, muscle, joints, it will not validate your fast as well. The most relevant example now would be your vaccines, of course. So if you take a vaccine during the month of Ramadan, it will not invalidate your fast. So just a short PSA for those who have not taken their first or second COVID booster, please do so, especially before the Raya season, because
how have
COVID
you not taken it, right?
Around.
Please go and take it.
Please, guys. I mean, it's a season where everybody is just going out. Places are getting crowded. Just to keep everybody safe, please do so. Exactly.
Other example would be, one more would be your sublingual tablet. So sublingual tablet is a tablet that's put under the tongue and it's not swallowed. So there is a medication like that. So they're commonly prescribed for patients who have just had a heart attack.
Yeah.
So that medication can help to alleviate their chest pain or their angina pain.
Okay.
So
if they don't swallow it, right?
it's just under the tongue. So you put it out for 5 minutes, and once the chest pain's gone, then you can take it back out. So it won't invalidate your fast. Another example would be a local anesthesia or partial anesthesia, because that's either injectable or spray on. One that I would like to highlight that you mentioned just now, you had asthma, so inhalers. So inhalers is a bit tricky. There are two different opinions when it comes to inhalers. So inhalers, if you're not familiar with it, it's a device that delivers medication straight into your lungs via your mouth. So you breathe in through your mouth to put the medication into your lungs, as per se. So that's where it gets a little tricky, because it goes into your mouth. So the first opinion does say that, you know, taking an inhaler does invalidate your fast. Because the components inside the inhaler, unfortunately, because it goes through the mouth, it will go into your stomach.
You're right.
But there is also the second opinion that says taking an inhaler will not invalidate your fast. Because one inhaler spray, you know, the water, the amount of water inside it is very negligible, and it's similar to gargling a mouthwash, so it will not invalidate your fast. And second of all, when you need to use an inhaler during daytime, it's probably because of an emergency situation, because, you know, you have a shortness of breath, you have an asthma attack, so you really need to use it. So that's why, you know, it will not invalidate your fast. So conclusion here, it depends on the patients. You know, it depends on what they believe in, what they read up. So it's up to them to decide whether taking an inhaler will invalidate your fast or not. Regardless, if they think they have broken their fast or omitted their fast, then they would have to make up for it some other time.
Because one of it is as well, you have to be yakin, right? You have to be confident in your fast. Because I've had similar issues so many years where I've read a different ulama or a different religious leader will say, no, if you take an inhaler, it will invalidate. Another one that says no, because like you explained, the water vapor is not enough to invalidate, and it doesn't go all the way to your stomach or something, that it goes sticks in your lung. So that's actually, again, all you need to do, again, ladies and gentlemen, if you are not, especially to those of you who are like me, asthmatic, taking inhaler, you got to be confident in that, okay? So thank you so much for the clarification. I'm so happy now, at least if I...
So now you know, Zoe.
Yeah, now the list of medication, I was just listing down in my head, okay, anything that you have to take in, no, cannot. It will invalidate.
So, but thank you for telling us about the types of medication and also how it should be taken and all that. But we're talking about how to take medicines during fasting, right? So there are some medication in which there are some requirements in taking few times, or how often you take it in a day, sometimes 2 times or 3 times in a day. So how would you advise for those patients taking those kind of medications during Ramadan period?
All right. So what we need to understand here, just because you're ill does not mean that fasting does not stop you from receiving treatment or continuing your treatment. So it's very important that if you're ill, if you have a chronic condition and you're on regular medication, so if you have diabetes, hypertension, asthma, that you continue taking it. If you don't take it, there's a risk of complications that might occur, that might land you in hospitalization, and that's what we don't want to. So if there's anything that you are not sure as a patient, please don't be scared, or please just approach any of the healthcare professionals, any of the pharmacists, and we can help you with that. So there is a general guide as to how you take your medication in regards to the timing, when to take your medication. I guess if it's once a day, for example, that's pretty straightforward, right? So you can choose when you want to take it. You can choose to take it either during sahur or during buka puasa. So if it's during sahur, if the medication needs to be taken before meal, then it's pretty easy. Like you just take it either 30 minutes or 1 hour before sahur. If it's after meal, then it's more straightforward. You just take it after sahur or after you break fast. 2 times a day, also pretty straightforward. So you can take it the first dose during the sahur time. So if it is before food, then you take it, like I said, 30 minutes to 1 hour before sahur. If it's after food, then you take it after sahur. For the second dose, if it's after food, then after you break your fast.
Okay. It's pretty straightforward.
If it's before meal, then what we would advise is that when you break your fast with a glass of water, maybe just sweet drinks, just to make sure that you don't have low blood sugar whatsoever. And you take the medication first, and then you wait about half an hour. Then only you take your main meals with it.
Okay. This is actually very interesting. So, do you need to have this little gap before you actually have especially for medication that is before meal? Because I always assume that literally it's before I eat.
Okay, it depends on some of the medications, really. Some medications you really need to have that gap because, you want to make sure that it works, so that it's not broken down, or you want to make sure that's the optimal absorption to your body. Some medications require an empty stomach to make sure they're optimally absorbed in the body. Okay. So if there are some medications where you need to follow, if it's half an hour or 1 hour before food, you do have to follow that.
Okay.
Or if you find it difficult because you want to break fast, you don't want to think about your medication yet, you can eat your main meals first when you break your fast, and then you have to wait about 2 hours. Then you take your medication.
Interesting. Yeah. I never knew this.
I know about the number of times we have to take medication, but I never knew we have to have a gap.
Like a little gap.
Yeah,
interesting.
So, I mean, when it's like before meal, I have food on the table. Okay, just eat it and then just head on to my meal.
All right. Exactly. All right. So we have a couple more minutes before we have to end the show. I'm very curious. So we mentioned a little bit about diabetic patients, right? So for diabetic patients who want to try and fast, how should they take their medication? What's your advice on ensuring that they stay on the medication and they don't fall sick?
Okay, so it is possible for patients with diabetes to fast safely. Again, I'm going to repeat this again and again. The most important thing is if you do intend to fast, you need to talk to your doctors or your healthcare professionals about it. If a patient with diabetes inform their doctors that they do want to fast. So what the doctors will usually do is they will do a complete checkup to make sure that you are fit, to check your health status, make sure you're fit to fast. They'll also talk about the potential risk of complications that comes with fasting. You might have low blood sugar or high blood sugar when you're fasting, so they'll talk about that. Talk about how to identify the signs and symptoms of low blood sugar and high blood sugar. So low blood sugar would be like when you're feeling dizzy, you're shivering, you feel like fainting, you feel cold sweats. If it's high blood sugar, when you have frequent thirst or frequent urination. So you need to learn, the doctors will tell you about that, and you need to learn to identify that symptoms and get ready to break fast should that symptoms occur. The doctors will probably also refer you to dietitians, diabetic educators to help you to plan a healthy menu or a healthy diet for the month of Ramadan. And of course, they will also refer you to the pharmacist. So the pharmacist will help you in terms of modifying your timing and the dosing and whatnot. So for example, if a patient is on insulin, so insulin instead of 3 times a day, so they just need to take it 2 times a day. So before food, they can take it half an hour before sahur and half an hour before breaking fast. So like I said just now, so when they break fast, they can have 1 or 2 pieces of kurma, inject the insulin, wait half an hour, and then they can
have a full meal. All right, interesting. So I think the biggest takeaway for me here is, of course, being able to fast while I take my medication, but most of all is the 30-minute gap.
The gap, right?
Before,
because we didn't know about it.
I didn't know about it. I've always just had my medicine and then maybe 5 minutes and then have a
meal,
plate of rice or whatever. So thank you so much again, Athirah, for coming on the show. Thank you so much for gracing us with your presence and educating our audiences. So again, ladies and gentlemen, those of you who are sick but you still want to fast, the number one thing that we repeated is that you have to get advice from your doctors, okay?
That is the main thing, actually. Just seek a healthcare professional, your doctors. See how you can fast or take your medication or what permits you to do so. So anyway, thank you so much, Athirah. Thank you for all the advice that you have also given us and new knowledge for us as well.
Exactly.